So please, can you hear me now? And can you see my screen in full? Okay, so we are ending up with disorders of the endocrine gland today. So today we are doing disorders of the thyroid gland. So now let's remind ourselves, where is the thyroid gland located? The thyroid gland is located in our neck, obviously. But which part? It is located in the anterior part of the neck. And what is the main function of the thyroid gland? What does it do? What is the main function of the thyroid gland? Or let's say the thyroid hormones. You know, thyroid gland releases different types of hormones. It releases the T3 and the T4. And it also releases calcitonin. So what are the functions? When I was talking about the Addison's disease and Cushing's syndrome yesterday, we first of all discussed about the functions of the hormones. So that when there is excessive secretion of this hormone or under secretion, definitely you will know the disease condition that is going to result in. So for the thyroid gland, it is the hormones of the thyroid gland that controls the rate of body metabolism. The speed of body metabolism, how our body converts food into energy. That is just the meaning of metabolism. So when you hear the word metabolism, that is how the body converts food into energy. So it is the hormones of the thyroid gland that controls the rate of body metabolism, and it produces 3 types of hormones. So we have the T3, the T4, and the what? Calcitonin. So take note. So let's discuss about the functions of these thyroid hormones one after the other. So what does the T3 and T4, what do they do? So they affect a lot of body functions. They play a lot of roles in the body, like how our body uses the energy. It affects the heart rate. Yes, how our heart functions, our breathing. It affects the lung, digestion. It affects the rates, how the food moves through our digestive system, our GI system. It also helps to regulate the body temperature. Then it plays a key role in brain development, mental activity. Then it also plays a key role in skin and bone maintenance, especially the calcitonin. So they play a key role in skin and bone maintenance and in fertility. Now, the calcitonin is the one that helps to lower the blood calcium level. And how does it do that? It does this by inhibiting the activity of osteoclasts. You know that osteoclasts are one of the bone cells. So it is a cell that this particular osteoclast is the cell that plays a role in bone resorption. So when you hear the word osteoclast, it plays a role in what? Bone resorption. So what calcitonin does is that it lowers the blood calcium level by inhibiting the activity of what? Osteoclast. Anytime the osteoclast is acting on the bone, what it does is that it breaks down. It helps in bone resorption. Bone resorption means breaking down. So when it is broken down, calcium will be what? It will be released into the bloodstream. And by that time, we have excessive calcium level. Or when the calcium level is what? Is high. So it is this calcitonin that helps to inhibit the activity of osteoclasts so that we don't have excessive calcium level. So I hope I'm making sense. Now let's go to hypothyroidism. So we are done with hormones that are being produced by the thyroid gland, the T3, the T4, and the calcitonin. So we are done with their functions now. So now when these hormones are either produced excessively or underproduced, what can it result to? So hypothyroidism, that means the thyroid gland hormones are being produced in lesser quantity. The amount that is needed for the body to function is not being produced. So when you have low level of T3 and T4 in your body, what will it result to? It will result in what? Hypothyroidism. And I told you earlier on that T3 and T4 helps in what? Maintenance of what? It helps to regulate the body metabolism. It plays a role. It regulates the rate of body metabolism. So immediately there is underproduction of T3 and T4, definitely you should know that the body metabolism will be disrupted. I told you it plays a role in breathing, in our in digestion, and lots more. So anytime these hormones are underproduced, definitely you know that all these functions will be what? It will be affected. So hypothyroidism state results from hyposecretion of thyroid hormones and is characterized by decreased rate of body metabolism. So everything is going to drop. the rate of body metabolism will be affected. It's going to drop drastically. Now, I want you to take note that the T4, when the hormones of the thyroid gland, when they are low in the body, the thyroid stimulating hormone will be elevated. So when T3 and T4 is low, the thyroid stimulating hormone will be what? It will be elevated. Because the thyroid stimulating hormone, it is being produced by the anterior lobe of the pituitary gland. And it is the thyroid stimulating hormone that will stimulate the thyroid gland to produce T3 and T4. So anytime we have underproduction of T3 and T4, the body will begin to think, it's a form of what? Negative feedback mechanism. So it's a form of negative feedback. So the body will begin to think that, okay, the hypothalamus, we know, it will stimulate the release of thyroid stimulating hormone, because it will begin to think that, the T3 and T4 is too low. It is too low. So thyroid stimulating, it will continue to release thyroid stimulating hormone, so that thyroid stimulating hormone can go and what? It can go and stimulate the thyroid gland to produce T3 and T4. So that is the mechanism behind having an elevated thyroid stimulating hormone when the T3 and T4 is low. So now we have two types of hypothyroidism. So we have two types. We have the primary hypothyroidism and we have the secondary hypothyroidism. Those are the two types. So in primary hypothyroidism, what happens in primary hypothyroidism? The source of dysfunction is from the thyroid gland. So that means the thyroid gland itself cannot produce the amount of hormone that is needed. So when the thyroid gland itself fails to produce the necessary amount of hormone, then you say a patient has primary hypothyroidism. But in secondary hypothyroidism, the thyroid is not being stimulated by the pituitary to produce hormone. So that means the problem is not from the thyroid gland this time around. So the problem is for what? It's from the pituitary gland. The problem is from the pituitary gland. Pituitary gland. So that means the thyroid, the TRA, thyrotropin releasing hormone, is the one that will be released. That one will go and act on the hypothalamus. That one will release, it will go and act on the pituitary gland. That one will now release thyroid stimulating hormone. Thyroid stimulating hormone will now come and act on the thyroid gland. So anytime the pituitary is having problem, then we call it secondary hypothyroidism. So now let's go to causes. I hope my explanation is clear. Are we still together? Okay. So let's go to causes of hypothyroidism. The first cause is iodine deficiency. The reason why this iodine deficiency can cause hypothyroidism is because the thyroid gland requires iodine to produce its hormones. The thyroid gland cannot just function. Even though there's something stimulating it, it also makes use of what? Iodine. There is a way this thyroid gland traps iodine from our diet and then use it to produce its hormone. So this iodine is a form of precursor for thyroid gland to produce its hormone. So the thyroid gland cannot produce its hormone without the help of iodine. So that is why it is important for you to educate your patient to take nutrients or diets that are rich in iodine. Take all these iodized salts. So very, very important. Then anti-thyroid treatment too. When a patient is on anti-thyroid treatment, there is high probability that the patient is going to come down with hypothyroidism. These things are hormone. I told you yesterday that they are not supposed to be in excess and they are not supposed to be underproduced. So when a patient is on anti-thyroid medication, a patient that has hypothyroidism, the patient is on anti-thyroid medication, definitely there is tendency that the thyroid hormone will drop excessively if you are not monitoring. So you notice that patients with all these thyroid gland disorders, they usually monitor their T3 and T4 from time to time. When they perform thyroidectomy for a patient, you notice that the doctors always order for this lab. They continue to monitor their T3, T4 because they don't want it to what? They don't want it to be in excess or underproduced. So that's another thing. Pituitary tumor can also cause it. Then thyroiditis, when the patient is having what? Infection of the thyroid gland. When a patient has undergone radiation before, a patient that has undergone radiation, you know, radiation has a way of affecting body function. Then autoimmune disorder can also cause, especially Hashimoto's. There's a disease condition we call Hashimoto's thyroiditis. So this one too can cause what? It can cause hypothyroidism. So it's just the kind of this condition in which antibodies continue to attack the thyroid gland, and it will affect the way they produce their hormone. So when you check the labs, when you order for investigation, you notice that the T3 and T4 will be low, but the thyroid stimulating hormone will be very high, because the pituitary gland will continue to think that the thyroid stimulating hormone is not enough to stimulate the thyroid gland. So this thyroid stimulating hormone will be produced in excess because the T3 and T4 is low. Now let's go to signs and symptoms. We have discussed about the functions of T3 and T4. So when you are hearing all these signs and symptoms, or you are seeing it, it shouldn't be strange to you. So a patient with hypothyroidism will definitely have what? Lethargy and fatigue. Because I told you that T3 and T4 affect what? It helps to speed up the rate of body metabolism. So by the time T3 and T4 is not there, you expect this patient definitely to be weak. Patient will have lethargy, the patient will have muscle aches, there will be tingling sensation, pain sensation, paresthesia, tingling sensation in the body. There will be intolerance to cold. This patient cannot tolerate cold because T3 and T4 helps us to regulate the body temperature. It plays a key role in maintenance of what? Body temperature. So a patient that has low T3 and T4 will have intolerance to cold. They will not be able to tolerate small cold. Then there is excessive what? There is weight gain. These patients are just in one place. They are weak. They cannot carry out their activities of daily living. So they have weight gain. This patient has dry skin. There is hair. Dry skin, hair. There's loss of what? Body hair. There is bradycardia, because their breathing rate is affected. Their respiratory rate is affected. So the pulse rate of these patients will be low. These patients will have constipation. One of the causes of constipation is sedentary lifestyle. When you are not really doing anything, you are not exercising your body, you are just there, definitely you are prone to having constipation. Then these patients we have what? Depression, because there is a way this T3 also functions in our neurological system. So this patient too, we have what? Low libido. If this patient we have low libido, because there is a way it affects the reproductive system too. Then another thing is generalized puffiness and edema around their eyes and face. We call it myxedema. Then forgetfulness and loss of memory. There's menstrual disturbances. Then goiter may or may not be present. But please take note, a patient can present with goiter with both hypothyroidism and hyperthyroidism. And how does this goiter occur? Because the thyroid gland is overworking. The thyroid gland is overworking. The thyroid gland is trying to compensate, trying to what? Produce more hormones. These T3 and T4 are very necessary in the body. So by the time the thyroid gland is stressing itself, then this patient will have swelling. So that is why the patient will have what? Goiter. There is tendency for them to have cardiac enlargement and tendency to develop heart failure. Now, what are the interventions? What are your nursing interventions? You have to monitor the vital signs, their heart rates and reading. Administer thyroid replacements like levothyroxine sodium. So you give this patient levothyroxine sodium. I think we'll still get there. So instruct the client about thyroid replacement therapy and about the clinical manifestations of both hypothyroidism and hyperthyroidism. When a patient is on anti-thyroid medications, when they are on thyroid replacement therapy, you have to monitor the level of T3 and T4. So you have to tell them about the key signs and symptoms, the clinical manifestations that comes with hypothyroidism and hyperthyroidism, so that when the patient is experiencing these symptoms, they can quickly do what? They can quickly report and tell you that, oh, as a nurse, these are the signs and symptoms that I'm experiencing. So definitely, by the time they start relating the signs and symptoms to you, you will know that whether these patients are having hyperthyroidism or hypothyroidism. Now, another thing is that you instruct the client in a diet low in calories. Instruct this patient to take a diet that is low in calories, cholesterol, saturated fat. Discuss a daily exercise program such as walking. You don't want them to take too much of calories. These patients are already down, although they are weak. So because if you tell them to take too much of calories, how do you want them to make use of it? Assess the client for constipation. If this patient is having constipation as a nurse, you give them what? You increase their fluid intake. You put them on roughages like vegetables. Provide a warm environment for the client because they are what? They are very sensitive to cold. Avoid any form of what? Sedatives. You have to avoid giving them any form of sedative because you know that all sedatives depresses the respiratory center. This patient already has bradycardia. Their breathing rate is already low. So you don't want to put them on any medication that will what? That will depress the respiratory center. They should avoid any form of opioids, analgesic, because of increased sensitivity to this medication. It may make the patient go into coma, especially the ones that have mixed edema. Now, monitor for overdose of thyroid medications. You know, when it comes to when the patient starts complaining of tachycardia, chest pain, restlessness, nervousness, and insomnia, instruct the client to report episode of chest pain or other signs of what? Overdose. Now, the major complication of hypothyroidism is mixed edema coma. So what do we mean by mixed edema coma? It's a major complication of hypothyroidism. It is a rare but serious disorder that result from persistently low thyroid production. So when the thyroid hormones, when the level gets low to a particular point, when it gets low to a particular point, a patient can present with this condition known as what? Mixed edema coma. That means the patient can go into coma. So coma can be precipitated by acute illness, rapid withdrawal of thyroid medication. When you stop thyroid medication all of a sudden. So you notice that medications, any medications that has to do with endocrine glands, nervous system, you don't stop the medication abruptly. It is a taboo because it can make this patient to go what? To go into coma or to have complications. So coma can be precipitated by acute illness, sudden withdrawal of thyroid medication, anesthesia, and surgery. Or when you give them sedatives and opioid analgesics, you don't do that in a patient with hypothyroidism. So what are the interventions in case you are managing a patient with mixed edema? What are your interventions? You know this patient is already in coma. So the patient will require you to go a further step for them. You maintain a patent airway for them. Institute aspiration precautions. A patient in coma, you have to make sure that, oh, this patient does not aspirate. Administer IV fluids, normal or hypertonic saline. Administer levothyroxine sodium. Yes. So you give them levothyroxine because their T3 and T4 is excessively low. Administer glucose intravenously as prescribed. Administer what? Glucocorticoids. So let's keep these signs and symptoms and let's go to medical management. Are we still together? I hope I'm making sense. Are we still together? Okay. Now, so let's go to medical management of hypothyroidism. So we have all heard about these drugs before. And at one point or the other, we have administered this medication to patients on with hypothyroidism. So the first medication is levothyroxine. The first medication that we use in treatment of hypothyroidism is levothyroxine. So what this levothyroxine does is that it releases what? T3 and T4 in the body. So what are your major intervention when a patient is on what? Is on levothyroxine? Very, very important. You have to know it. When a patient is on levothyroxine, you do blood work every 6 to 8 weeks. You don't just want to put your patient on levothyroxine and just forget about it. If not, it will get to a point the patient will have hyperthyroidism. The T3 and T4 level will go way up. So you have to keep on checking every 6 to 8 weeks, then every 6 months and yearly, so that the level of the T3 and T4 will be normal, will be maintained. You want to control the level. You don't want them to increase and you don't want them to be low. So you ask the patient to take the medication every morning with full glass of water, about 30 to 60 minutes before breakfast. So these are the precautions you take as a nurse when your patient is on what? Levothyroxine. Then you tell them that it is a lifelong medication. It is a lifelong medication. And it takes about 3 to 4 weeks before it can what? It can start working. So when your patient is on levothyroxine, and the patient comes to you after 1 week as a nurse and say, oh, I'm still feeling all the signs and symptoms I used to feel before you people place me on medication, I'm not getting better. So as a nurse now, you now know that when your patient is on levothyroxine, it takes average of 3 to 4 weeks, that's like a month, before the patient can start experiencing any form of what? Relief. Then you let the patient know that this drug is very active. You want to use this levothyroxine to increase the level of T3 and T4. So it can make the patient to have high heart rate. It can cause tachycardia, it can cause hypertension, it can make the rate of body metabolism to go up, to increase. So you have to tell your patient to take note of signs and symptoms that comes with hyperthyroidism so that they can quickly report in the clinic, at the clinic, when they're having these signs and symptoms, because you don't want your patient to have hyperthyroidism. Then this medication is what? It is safe in pregnancy. A pregnant woman that has low T3 and T4 can also use it. You tell your patient that this drug does not cure. It will not cure. It will only what? It will only treat the symptoms. It will not cure it. Then patient should not double the dose. Maybe peradventure the patient missed a dose and forgot to take it. They should not now, maybe when they now remember, they will not take double dose. It is prohibited. Never. Then it must not be stopped abruptly so that patient will not go into what? Into crisis. So hyperthyroidism, I will not spend much time on hyperthyroidism because it is just the opposite of what is happening in hypothyroidism. There is high level of what? T3 and T4, excessive secretion. So what will you expect in hyperthyroidism? Patients will be hyperactive now. Patient will definitely be what? Hyperactive, because the rate of body metabolism has increased. It has doubled from the normal. These patients are always what? They are always hyperactive. They cannot sit down in one place. The level of T3 and T4 is just what? It's just too much, more than what they can bear. So a common cause is what? Graves' disease. So this Graves' disease is also known as toxic or diffuse goiter because of too much of iodine, too much of medication. It can be as a result of too much of iodine. It can be as a result of too much of medication. I just finished speaking about what? Levothyroxine. That when you treat hypothyroidism to a particular point, a patient can also have hyperthyroidism. So you have to continue to monitor the level of T3 and T4. The clinical manifestations are referred to as what? Thyrotoxicosis. So the T3 and T4 are usually elevated, and now the thyroid stimulating hormone will now be low. So can you see the difference now? So in hyperthyroidism, the T3 and the T4 will be high, but the TSH will be low. So what are the signs and symptoms you're going to see in a patient with hyperthyroidism? They usually comes down with exophthalmos. Their eyes usually bulging eyeball. I've seen a patient like that. The eyeball will almost like it wants to drop, or it wants to come down or fall down. So now these patients can come down with goiter. And I told you that, take note, a patient with hypothyroidism or hyperthyroidism can present with goiter. So you can see goiter in both disease conditions. Patient is going to have high BP. You can see that all their signs and symptoms are usually on the upper. I used to use the word upper. So their signs and symptoms is usually on the higher side. High BP, can you see, like 180, 100? And when once the patient is having hypertension, having blood pressure of 180, 100, this patient can come down with what? Aneurysm, hem high, coronary artery disease, and a lot of complications. These patients can have tachycardia, palpitation, atrial fibrillation, high temperature. Patients will have high temperature because T3 and T4 also what? They controls body what? They controls body temperature. So these patients, they are what? They are always sweating. They have diaphoresis. They can't tolerate heat. There is heat intolerance. Then there is high what? GI. The gastrointestinal tract will be what? Hyperactive.